So here's the problem of saying it's all in your head. Here lies Harold Gordon Mexville. See, it wasn't psychosomatic. So that's what you were suggesting before. So I'd like to turn now to the other thing that Dean Pizzo mentioned, which is my work with stress support and cancer. Yes? You have a question? Yeah, that's fine. Go ahead. Sure.
About nitrous oxide. I think it is the most wonderful thing for when I have oral surgery. I'm like, sure, bring it on. And I thought of that when you talked about the difference between pain and between hurting and feels like it hurts. No, maybe that's not how you said it.
Yeah, sensation and suffering. Yeah.
I know it hurts. I mean, there's pain, but it doesn't hurt.
Right.
People told me that's impossible, that you feel the pain, but it doesn't hurt. So I thought maybe you could address which part of the brain used it, or whether it's up part and down part. And why won't they use it for other procedures like thyroid biopsies?
Well, you know, there's always a risk-benefit ratio, and anytime you mess with consciousness, bad things can happen. You know, people can, for example, get nauseated and throw up and then inhale some of the food if they're not fully conscious. So we tend to avoid reducing consciousness except for really serious situations where you have to prepare more, you have to have more emergency equipment available. Nitrous is pretty good. It tends to give you exactly that sense. It's like opiates do this too, where you know the pain is there, but it just doesn't bother you very much. And so there are times, typically with thyroid biopsies, you know, a little local injection is usually enough to avoid the discomfort, but not for some people. But frankly, what I would like to see is more use of teaching people self-hypnosis to manage the pain, because as I showed you earlier, it is very effective. It doesn't take long to do, and it can really help with the discomfort. Yes?
Does hypnosis work in childbirth?
I'm here to tell you it does. My wife, Helen Blau, is a professor of molecular micro and immunology here at Stanford, runs the Baxter Laboratory, does stem cell research. We have 2 children, and we decided that we would use self-hypnosis rather than epidurals for the delivery. And Daniel was 10 pounds when he was born. He was the first child. He's now 6'4". He's very large. And halfway through her 8-hour labor, she said to me, "David, you know, I'm a pharmacologist too. There are drugs for this." and I said, "Deep breath, you're floating in Lake Tahoe, cool, tingling in And Daniel was born fine, and I had no pain at all. So, and our daughter Julia was born in 4 hours of labor, very little pain, all self-hypnosis. So the answer is yes, it works. Yes, in the back there.
I have a question about language.
Yeah.
Do we process language in the same parts of the brain independent of the language we are speaking?
Yes, pretty much that's the case. We have one language center, Wernicke's and Broca's area, usually in the left temporal lobe, some in the right as well. But yes, it doesn't depend on the language. Yes?
2 things. One, I read in, I guess it was Newsweek or Time where medical records got switched, and someone who was told that he had cancer that was inoperable and had 2 weeks to live. And in 2 weeks he passed away, and then the doctor realized that he was given the wrong diagnosis. So talk about mind-body thing. But my question really is, when you're talking about hypnosis, it also sounded like meditation to me. You know, going to another spot and you know, feeling better in that area. So I'm wondering if you see much difference in that.
Well, I'm asked this a lot, and I have colleagues who are experienced meditators. And I think probably the mental state you get into, particularly if you're highly hypnotizable when you're meditating, is pretty similar. But the ceremony surrounding it is very different. Hypnosis is much more Western-oriented. It's problem-focused. You use it to focus on a problem and alter your perception. Almost by design, the Eastern approaches are non-problem focused. So the ceremony involves doing your mantra or doing a body scan or something. I think you're in an altered mental state that isn't too different, but you're not trying to solve a problem. You're trying to just live in the moment and focus on your breathing, and then let the problems kind of take care of themselves. So the ceremony is rather different. I suspect that the mental state, and we're actually starting to do some research on that, is pretty similar. Yes?
I I was told by a professor at an unnamed medical school about 20 miles north of here that
What could that be?
children under 10 can't receive placebos, or placebos are ineffective on a child under 10. Is that correct?
That's absolutely incorrect. And in fact, the peak period of hypnotizability in the human lifespan is from like 6 to 12. All 8-year-olds are in trances all the time. You call them in for dinner, they don't hear you. So that's a wonderful time, actually, to take advantage of the placebo effect. Yeah. So that's why they're 20 miles to the north. Yes.
Some years ago, I'd been reading about a psychiatrist who used hypnosis, and he put people into hypnosis into an earlier life that they had experienced.
Yeah.
And somebody who had a problem with their throat, couldn't wear a necklace, was hung in an earlier life, which accounted for that deficiency.
Yeah, this is past life regression. My dad used to say, I have enough trouble figuring out what's going on in this life. If you can have vivid fantasies, there's hypnotic age progression too. And so you can have a very vivid fantasy about who you were in a past life. It has nothing to do with the reality of it. So I don't put much stock in it. There was one of these trance channelers years ago, and one of the local TV stations asked me if I could explain it. And I said, well, bring me a high hypnotizable and I'll give you a trance channeler. So Wendy Takuda came down from Channel 4 with a camera crew and brought one of her crewmen who was highly hypnotizable. I hypnotized him and said, there's a spirit inside you, let it speak. And he said, I am Zafra, and I bring a message of peace. And he goes on and on. And I pointed to his boss, and I said, who's that? And he said, he couldn't say her name. And I brought him out, I showed him the tape. He thought it was incredible. He couldn't believe he'd said all this stuff. And Wendy Takuda looked at me and she said, Doctor, I'm glad that you do what you do and I do what I do, and I'm getting out of here. So yeah, it's fantasy, yeah.
Has there been any work done on how hypnosis and people who are hypnotizable and how that works with their sleep and sleep patterns?
It's an interesting question. Yes, I should repeat. Has there been any work on the relationship between hypnotizability and sleep patterns? Despite the name hypnos, the common root which means sleep in Greek, hypnosis is not sleep. It's actually a form of highly focused attention. I don't know of many studies on sleep patterns of high versus low hypnotizable. It's a very interesting question. My impression is that highs sleep better than lows. Lows tend to be more anxious and they have trouble turning off their thoughts. And we actually treat people with sleep disturbance by having them just be a traffic director to their thoughts, to project them onto an imaginary screen rather than experiencing them inside their bodies, where they tend to get the sympathetic arousal that keeps them awake. But it's a good question. I don't know of any studies on actual sleep history of high versus low hypnotizables. Yes?
All these wonderful benefits for, in the medical setting for being hypnotized, self-hypnosis, is that available at all to people who are low hypnotizables?
It's a good question. In general, there's less of it available. I wouldn't say none. And when I find somebody who isn't hypnotizable, I always test them first. I say, well, let's do something else. So I'll do progressive muscle relaxation, or I'll be more likely to prescribe a medication. But interestingly, in this study, in the radiology study I mentioned, we measured hypnotizability, and it was uncorrelated with results. And we think that in really high stress situations like that, whatever ability people have, they use it. So I'd say the more pressure they're under to perform, the more they'll make use of whatever they've got. But there's about a third of the adult population that just aren't meaningfully hypnotizable. Yes? Yep, lady in green.
Are people who follow like charismatic, you might say mesmerizing leaders, rather blindly, tending to be high hypnotized?
Yeah, I think so. I thought for the Jim Jones catastrophe, for example, that a lot of those people probably were. I mean, if you look at these situations, they focus on one thing. The more irrational it is, the better. They suspend critical awareness. They don't focus on contradictory information that might scare them. So it wouldn't surprise me if not everyone, but a substantial proportion are pretty hypnotizable. So it's a vulnerability as well.